Good evening and welcome to In the Studio. My name is Dr. Marc Schenker, Associate Vice Provost for Outreach and Engagement at the University of California, Davis, and Director of the Center of Expertise on Migration and Health, a part of the University of California Global Health Institute. The topic of tonight's program is cultural factors affecting migration and health. And we're going to explore this topic with my guest, whom I'm delighted to introduce, Xochitl Casteneda. Xochitl is Director of the Health Initiative of the Americas at the University of California at Berkeley and has devoted her life to this issue. So perhaps let's just start, Xochitl, by telling us how you got interested in the topic of the health of migrants, and we can go from there.
Okay. So when I came to this country 15 years ago, I was doing research. I came from Mexico. I was a researcher at the National Institute of Public Health, and we got awarded with a grant to do some research on the sexuality and HIV/AIDS of migrant farm workers. It was the first time for me to come to a field work, and I went to Salinas, California, and I saw for the first time what were the conditions these farm workers were living, the lifestyle they were having, the lack of access to services, not just to health, but in general. And it was a day I still remember in which there was a farm worker, young farm worker, and was bleeding. And when I approached him, I said, "What's happening?" in Spanish. I'm a migrant myself. I come from Guatemala and Mexico. And he saw at me and said, "Güera," which in Spanish is already like a separation, means white. You know, I have more than 8 days of having this terrible toothache, and I have no access to the doctor. I don't know what to do, and I just take it out. So that shocks me, and that was like the tipping point for me to say, wow, you know, it's great that I am doing research on these topics, but I have to do something else. And that's the day that I vividly remember I decided I really need to do programs that focus more on the health of these workers. And the health of these workers is not just a responsibility of the host country, but we have to involve also the country of origin. And those days, the government of Mexico was changing. I approached the new authorities and I asked them, help me to do this program for the workers of Mexico who are living in California. And we started there, the Health Initiative of the Americas.
So you created the Health Initiative of the Americas, and this is different from many academic programs, even though it's based at the University of California. What is the goals of the Health Initiative, and how is it different from many academic programs?
The Health Initiative of the Americas started as a California-Mexico Health Initiative. We started working just in California and Mexico. And then we gradually have been expanded to work now in 40 states of the country and 3 provinces of Canada. And we work with 7 Latin American countries. That's why we are the Health Initiative of the Americas. And we do work in research, which typically is one of the major avenues of the university, but also we work in the provision of services through our partner organizations here and the training of not just students, faculty and clinical personnel, but also community members, and now we are devoting a lot of our efforts to promotoras, outreach workers who are there at the community and who are kind of at the front line working with this underserved population.
So is it fair to say that a major goal of the Health Initiative is really translating knowledge and education into programs that are going to improve the health of immigrants?
Absolutely. Our translation, our efforts are one of the key bones of the program. But what really guides us is that we are trying to rehumanize migration and not just see numbers or diseases, but really focus on the individuals, on the populations. And for us, which guide our day-to-day, are ethical principles, I will say. For instance, we truly believe in the dignity that these workers deserve health, but health with dignity, because they contribute so much to both countries, not just in this case Mexico, with the remittances, that is the second or the third largest source of income to the country, but also to this country, to the United States of America, which will not be so competitive without the valuable contribution of migrant workers. Today, it is estimated that 1 out of 6 workers in the United States is foreign-born. And that's just an example of what is going on globally. And I am convinced that the University of California, being placed in a state which is the most important, well, at least in economical terms, a state of this country, it's a great example for other parts of the world to deal with this population.
California also is a state in which 25% of our population are foreign-born, which is
Yes.
highest in the country. But I want to get at this topic you raised about humanizing the migrant, because I think it may take us into the area of cultural factors and social determinants of health. Do you see that, this dehumanization of immigrants by many in the population, as affecting the health, or is that a factor that comes into how you approach improving health in the population of immigrants?
Oh, it's a very good question. I think first, health is a human right, and we have to place the discussion then in the human rights arena. And I am convinced that all human beings have the right to have a quality of life in which health is one of the basic pillars. So it's not just that you produce or that you are here to satisfy the demand of work, but you have to be approached as a human being with your needs, with your dreams, with your health problems. And it's not just regulations. You are an authorized worker, then you are not eligible to receive subsidies, or you are not eligible to have health insurance. Or now, for instance, with the affordability, with the health reform, some of these undocumented workers are going to be excluded of the benefits of the exchange of the subsidies, and being the persons who need perhaps at the most. And you know, when it's a matter of a breakout or an epidemic, it doesn't ask you, do you have papers? Do you have health insurance? Health do not know those borders.
So let's get into some of these cultural factors that affect health among immigrants. Certainly the issue of healthcare access is one, but what about the cultural change when you come from another country, perhaps from another environment to the United States? How does that affect the status of the individual or the family's health, or the factors that are going to relate to them?
Well, I think cultural factors are important, but are not necessarily the most determinant ones. I think, for instance, poverty, access in the terms of not just the health services, but the providers themselves, who might not speak or understand the cultural or the health-seeking behavior of the population they are dealing with, are other factors that need to be considered. And for instance, it's important to differentiate because not all immigrants are the same. I came to this country as an immigrant, and there are some statistics that show that 1 out of 3 PhDs that are produced in Mexico are here in this country. So there is a brain drain too. And perhaps those PhD or those educated people do not have the same health barriers that an undocumented farm worker will encounter while seeking. So cultural behaviors and kind of the seeking of services related to culture, of course, it's an issue that needs to be considered, but it's not in isolation the only one. And for example, when you are talking about cultural things, I think there are individual, family, gender, age issues that need to be considered as part of this culture with a big capital C.
Perhaps it'd be useful to step back a bit and talk about the reasons that people migrate, and from that some insights into these factors that affect health in its entirety. And let me say that even though I'm a physician, I'm very well aware as a public health practitioner of all those non-medical care factors that affect health. In fact, many estimates now are that 75 or 80% of your health is determined not by the health care you get, but by your diet and your environment and your family and other factors.
Your lifestyle.
Right. So let's step back and look at why migration is going on, and then from that perhaps some of those factors as they relate to determinants of health.
Yeah. So I think it's very interesting what you asked, because the causes of migration have to be examined to answer your question. And there are different motivations, different triggers that make the people to migrate. And it's very important to differentiate, for instance, migration for seeking work, or for family reunification, or because of environmental conditions or political conditions, than it is tourism, that I want to go to another country and experience what their food is. It's very different. What we are doing these days, for instance, in the training of healthcare personnel that deals with this population, is contextualize the migration as a cycle which has at least 5 stages. The preparation in the countries of origin, the transit, that for many migrants is not just one border, but for instance for Central Americans means many or multiple borders. Even in a country there might be multiple borders that they have to cross. Then the arrival to the host country, to the country of destination, then begin to be part of here, the acculturation process that you pass, in which you begin to be part of a broader society, and your cultural values have to negotiate with the values of the host society. And then what happens once you begin, or you come back to your country of origin? So these 5 different stages of migration, and what happened with your families that you left behind, will determine a lot of the health seeking behavior, or the health conditions that this population is experiencing.
I think it might be useful to point out that migration has been a process as old as human history, from the origin of humans in Africa to the spread across the continents, that at its base it's an equalizing factor, with people moving to all change or equalize disparities that exist. Or if we take the recent history in the United States, we go back 150 years, migration has been constant over that time, with some rises and some falls, but we've always been a country of immigrants, and the factors that drive immigration have in one sense been constant, although they change in their proportions. So for example, political driven migration may be greater at times when that is driving people from certain countries, and maybe less at other times. Economic differences may affect migration. It really brings us to the major factors underlying migration, and I would suggest that economic disparity is the largest cause, that the greatest number of migrants are moving to improve their economic well-being or their family's well-being. Is that something you'd agree with?
Absolutely. I think I'm convinced that migration is the motor of the history. It's because of migration that the human beings, starting with the Pithecanthropus erectus, started to seek for better places, to begin to acculturate or to be friendly with the environments, and today definitely the causes being various. For some people it's not one in isolation, it's economic but also political, and also could be driven by environmental issues. It's for example, the United Nations estimates that by the year 2020 there are going to be around 40 million environmental refugees. And we are facing global warming. We don't know what's going to be the migration pattern of this new Pithecanthropus erectus. So for sure, migration is at the bottom of history. Today, unfortunately, with the concept, the modern concept of the nation, of a nation, migration or the natural movement of people has been constrained by certain regulations. And unfortunately, in the case of the United States, which is the country, which is a country that today receives perhaps the major migration flows of the world, at least of this part of the world, because China, India are other realities. And it's vis-a-vis Latin America, because the majority of immigrants today since the 70s come from Latin America, and mainly from Mexico. We estimate that there are around 33 million of Mexican origin population in this country, and that's major. And the regulations today difficult a lot this natural, I will say natural phenomena that has been the motor of the transformation of humanity. And perhaps it's a moment in which we really need to revise some of those macro policies, binational policies, regional policies, even state policies, because there are variations between state to states and regions in the same country.
It is important to recognize that migration has an origin and a destination, and both are impacted by the phenomenon. Mm-hmm. And there are indeed benefits and hazards in both the origin and the destination locations.
And I will say it goes even beyond the origin and destination, because it can go and affect the positive and the negative effects of migration second and third generation. It's not a casualty that, for instance, the health indicators of Mexican Americans are not very positive, and that's a second generation. Or how do you explain, for instance, that a lot of the children of Mexican immigrants, of Latino immigrants who are US citizens because they have been born in this country, do not have access to health services because of the documentation status, for instance, of their parents. So it affects the origin, the transit, the destination, but also the generations, and I will say the large society in itself.
That raises a really interesting question, which is not just the change among the immigrant, but the children of the immigrant who grow up in the new country. And is there an influence of that on the health of that generation? And is that to do with being between two cultures or seeing cultural change in a rapid way? Is that something that you have looked at?
Well, definitely the cultural aspects are important, but I want to highlight that the bottom is the inequalities. And for instance, it's not for free that some of these children do not have health insurance, not because of them, but because the type of work their parents perform. And some of these workers are not offered or cannot afford or are not eligible to access some of the health programs. And in the United States, health is not a human right in the sense of universal access. Health is a commodity, and you need mechanisms to access it. Either you pay or you don't receive. And you need a health insurance, for instance, in order to have regular access to health. And you as a doctor know what does it mean to have a regular checkups. Even it's more when you are growing up. It means to have the children needs certain vaccination, needs certain type of periodical assessment that they might not have.
But there are these other factors that change as well. Let's talk about diet, or let's talk about mobility, or let's talk about behaviors that, within social peer groups. Are those things that are impacted by migration status and affect the health? And have you seen those? For example, you did work in STDs, and some of those were populations that may migrate, or there are certain parts of migrant populations in which that's a risk. Is that related to the condition of being a migrant, or does that affect that outcome?
Or both. And I think it's where you place the blame. And you can say, well, it is your fault, and it's at the individual fault that you do not have a healthy eating behavior and that you do not exercise. And you are the responsible, ultimately, of that, and you can change that. But let me put the situation. What happens if you live in a context in which safety is not there necessarily? You are surrounded by gangs, like it is the reality of many societies or enclaves where Mexicanos, Latinos live, and you don't, and there are food deserts, even in areas which are agricultural, very vast production of agricultural commodities. Perhaps for this population, access to a certain kind of more healthy food is not in their day-to-day. So I think for sure there is an issue that relates to behavior and to individual behavior, but also there are contextual things, what we call the ecological circumstances.
So let me first say that as a public health practitioner, improving health is not about assigning blame. It's about improving conditions and raising everyone up. And I think there's too much of that in many contexts, not even related to immigration. But we're running out of time, and I want to move to some of those translational questions. How do you take this information and actually make a difference within the context of this country and the realities that exist here? Is it possible? Can we think about that? Can we envision programs that would actually reduce the disparity that exists, improve the health of the immigrants?
Well, the Health Initiative of the Americas has been blessed by the support of the Mexican government and the government of the other countries, which have trusted us and provide us with resources, for instance, to sponsor research, but research that has a translational component. So we have this program called PIMSA, in which binational teams of researchers are funded to produce scientific research. And then we, as a team and in conjunction with them, produce a series of materials for those who take decisions to do it in an informed way. So we do fact sheets of policy briefs based on the research, but also we produce materials for providers like dictionaries or manual trainings for promotoras based on this fantastic research done by researchers from both countries. And so the research is not just published in peer-reviewed journals, that it is for sure, but it also has a public service function.
Well, we're out of time, but this has been really a fascinating insight to a very large issue. But I have to say that I am the optimist, that I don't see these things as static, that I think they can be addressed. And I'm delighted to have had you on the program and to have the Health Initiative of the Americas and others who are working to address this issue, to reduce this health disparity, to improve the health of immigrants, and to address those factors affecting it, the spectrum of factors from healthcare to poverty to behavior and so on. So let me thank you for coming and for your contribution. It has been a pleasure. And we can continue this discussion at another time because there's many more topics to cover related to it. So
thank you very much for the opportunity, and I am also optimistic. I think this year is going to be historical. Perhaps we will have immigration reform, and perhaps the implementation of the health reform will also be in place.
Thank you. My name is Marc Schenker. This has been In the Studio, discussion on cultural factors and their influence on health among migrant populations.
Thank you.